We're gonna start by just assessing. We're gonna also assess the scapula while we're here. Can I ask you just to reach down and touch your toes really quick? We're just gonna look to see if the spine is symmetrical and there's no showing of scoliosis. All right, and we're going to just palpate really quick. Just tell me if you have any tenderness. Any tenderness? Nope. All right, while we're here, I'm gonna put my hands on about the 10th rib, and I'm gonna ask her to take one deep breath, and we're gonna see if her lung span is symmetrical. All right, you can breathe in. Okay, release. All right, it's symmetrical. And we're going to percuss. We're gonna listen for resonant sounds. To just pull your arms forward just a little bit, just so I can get your scapula out of the way. Now we're just going to listen. Take a deep breath. All right, no adventitious sounds noted, all regular rate and rhythm. And if I were in a scenario where it was just the privacy of me and the patient, I would have actually put the stethoscope on the skin of her chest so that way I can hear all sounds, and making sure that I'm ruling out not having the stethoscope on her clothes and making sure I'm hearing everything correctly. But for the purposes of this is why we have just a jogging bra. And one on top of it. All right, I'm just gonna ask you to lay down really quick. And before we start the actual stomach, I'm gonna just look at the neck again. We're gonna revisit the JVD, and we're just looking to see if there's any jugular vein distension. We're looking on both sides, and then I'm just gonna ask you to just kind of sit up really quick. This spine's at about a 30-degree angle, and I don't see any JVD distension on either side, so now I'm gonna ask you to just lay back down. All right, awesome. So now we're gonna start with the abdominal area, and we're gonna look for any pulsations, any hernias, any lesions, any mass, if she had any wounds, if she had any G-tubes. And before we do anything, we're going to also tape with the bell, and we're going to listen for any bruits. So we're going to start with the abdominal artery. We're going to do the renal arteries, and we're going to do the iliac. I'm just going to pull down a little bit, which is about right here. Okay. All right, no bruise or noted, and now I'm just going to listen with the diaphragm. I'm going to listen for her bowel sounds. Sorry, got all tangled. All right, we're going to listen to all 4 quadrants going in clockwise motion. Bowel sounds noted in all 4 quadrants. We're going to do a light palpation. We're going to see if we feel any rigidity. We're going to also see if she has any tenderness. So just let me know if you have any tenderness, okay? We're going to start with a light palpation. Any tenderness? Nope. All right, now we're going to do a deep palpation, okay? Feeling for the same things. No pain? Nope. All right, so no pain, no rigidity. We're also now going to percuss we're going to do the liver, which is on this side, and then the spleen, we're listening for tympanic sounds, and if there's any dual sounds, it would show that there's probably fluid. Okay. Now we're going to listen to the spleen. So spleen and liver tympanic sounds were noted. I'm going to ask you to just close your eyes really quick before we stand you up. I want you to just let me know whenever you feel me just touching you. All right, it's for sensation. So. No. Yes. 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 All right, so sensation is normal on both sides. I'm going to ask you also, you can open your eyes now. I'm going to ask you to grace your heels because we're looking for the neurological part. I'm going to ask you to put your feet at the base of your foot, and I want you to go up and down your shin. You can do one foot at a time.
All right, so I'm going to listen using my belt and my diaphragm, and I'm going to be counting out loud where I'm checking it. Okay. If at any moment you need me to stop, just let me know.
All right.
All right, so first I'm going to start with your aortic. So it's going to be on your right side over here, and it is going to be in the second intercostal space. So I'm going to find your clavicle, and then there's a clavicular space, and then this is rib 1, and then 2, and then the space. So I'm going to take a listen. We're just listening for that lub-dub sound. Perfect. And then I'm going to switch to my bell in the same place. Perfect. And then I'm going to move over to your pulmonic, which is also going to be in the second intercostal space, but on your left side.
Okay.
All right. So I'm going to find your clavicle, your first rib. Here's your second rib, second intercostal space. I'm going to listen again with my bell first, or my diaphragm first, I'm sorry. And then I'm going to go ahead and listen with the bell. Good. So next I'm going to go to your third intercostal space, which is your Erb's point.
Okay.
So we had that. We have a midclavicular space, so first rib, intercostal, second rib, intercostal, third rib, intercostal. So I'm going to go ahead and listen with my diaphragm. All right, and I'm going to flip it over into my bell in the same spot. All right, and then I'm going to go to the fourth intercostal space, which is your tricuspid. So we're going to go clavicle into clavicular space, first rib, space, second rib, space, third rib, space, fourth rib, space. All right, so I'm going to listen with both sides again. Perfect, and then I'm going to flip it over and go right back to the same spot. Sounds good. And then I'm going to go to your mitral valve, which I'm going to count your apical pulse for 1 minute. So I'm going to go down from here. I'm going to find your fifth intercostal space. So I'm going to have your clavicle, clavicular space, first rib, intercostal space, second rib, intercostal space, third rib, intercostal, fourth rib, intercostal. I'm going to go this way. Fifth rib, intercostal. All right, so I'm going to go over from here, and then I'm going to follow down from your midclavicular line, about right here. And then, do you mind if I lift this up a little bit?
Yep, that's fine.
All right, I can hear it, so I'm going to count for just 1 minute.
Okay.
Okay, so I got 72 for that one.
Okay.
Which is also, like I told you earlier, that's normal. I'm going to move on to your abdomen.
Okay.
So we're all good with the heart. They all sounded good. The normal love dub. I'm going to move down to your abdomen. Can I fold these over just a little?
Yep.
Okay. All right. So first I'm going to start by just looking at it. Everything looks normal. Color's normal. Temperature's normal. You have a belly button ring.
Yep.
Does that give you any problems?
No.
Anything like that? All right. So I'm going to listen first, starting in the right lower quadrant.
All right.
Using my diaphragm. So I'm going to listen. And then I'm going to go in the right upper quadrant. All right, so what I was listening for there was just bowel movements, and you had more than 5 active bowel movements in each quadrant, so that's good. When was your last bowel movement?
Earlier today.
Okay, and then I'm gonna listen to your abdominal arteries while I'm listening. So I'm gonna use the bell of my stethoscope, and I'm just gonna listen for bruits, just like we did in your carotid artery, okay?
All right.
So I'm gonna start with your aortic. Perfect. And then I'm going to go to your renal, and I'm going to go to your right renal first, and then your left renal, and then your right iliac, and then your left iliac, and then I'm going to listen to your femoral pulses.
Okay.
So I'm going to listen to your right femoral first.
Okay.
All right, and then your left. All right, no bruise in any of the arteries that I just checked.
Okay.
I'm going to percuss your abdomen now. So I'm just going to do the light tapping like I did on your lungs.
Okay.
We're going to be listening for the same sound.
Okay.
And again, I just started in the right lower quadrant and making my way.
Okay.
Okay, so all sounded good to me. I'm going to percuss the border of your liver, so we're going to hear a more of a dull sound, so I'll let you know when we hear that, okay?
Okay.
You hear how that's a little more dull?
Yeah.
All right, so liver border seems good. Everything around in your abdomen seems good. I'm going to palpate, so I'm going to go lightly first, so just a light pressing.
Okay.
And then I'm going to go deeper if there's no pain. Okay, so let me know if you have
Alright.
any pain. I'm going to start in the right lower and make my way around again.
Okay.
I don't feel any bumps or anything abnormal. Do you have any pain?
Nope, no pain.
All right, we're going to do a little deep, also starting in the right lower. All right, any pain with those?
Nope.
All right, felt normal to me too. Oh, I think we're good for that, so I can take that back.
All right.
Thank you. Set that back up. Perfect. All right, so I'm just going to check your legs.
Okay.
Can I take your socks off?
Sure.
All right. All right, I'm going to check the capillary refill in your toes. It should be less than 3 seconds. Perfect. I'm going to look at your legs. Temperature is normal. Not many lesions, just a few scars on your knee. Just old stuff.
Yep.
All right. Any problems with your knees?
Nope.
All right. Temperature is good. Symmetrical muscle tone is good. I'm going to feel your femoral pulses for symmetry, and then we're going to go down your legs for those as well, okay? Okay. I'm just going to do the first one. If I can find it. There it is. Perfect. All right, and then this one. Good. They're both beating good, and they're symmetrical. I'm going to do your popliteal now, behind your knees. There they are. And then I'm going to move down to your dorsalis pedis on top of your feet.
Okay.
Good. And then your posterior tibialis on the inside of your ankles.